Hey, I'm Dr. Brian McKay of Core Health in Darien, and today I want to talk about a topic dear to my heart, and it's how you choose or how you may want to choose a chiropractor. I'm going to try to keep it as objectively as possible, but I think it's important that people who haven't been to a chiropractor try to understand that, like any profession, there's good chiropractors and there's bad chiropractors, there's good MDs, there's bad MDs. Hopefully, you're going to have a good one. And what I think is important, first of all, is um, you make the phone call. You can always schedule online. I think it's very impersonable. But what I think is important, if you it depends how you treat it with the call. Are you greeted nicely? Are you friendly? Because this is all a reflection on how you're going to be treated in the office. If they're treating you with respect on the phone, that's a really good thing. I mean, you have questions you want to get answered, you're entitled to have these questions answered. It's like when you go to a restaurant and say, well, how are you going to prepare the fish? There's no there's no reason why you shouldn't have this available to you as a potential chiropractic patient. So, all right, I have 30 years of practice experience. So I think that people with this much experience can be good because they've been doing it so long. They know what's out there. They pretty much know how to treat a spine, how to get somebody well. I also think that most chiropractors my age or my years of experience will have um, more anecdotal knowledge about what they can help, and so that's a pretty good sign. I think is okay. One of the safest things to do is look at the number of reviews. That to me is a big thing to look at, and read the reviews. They can't all be fake. I mean, hopefully not. But my take would be is find somebody who you want to go to who's close by. I mean, the chiropractor near me is one of the most popular keywords for chiropractors these days for good reason. You've got stuff you want to do. Hey, have at it. Just let's do it where it saves you time because I'll be honest with you. You have a long term. If you've had say back pain for 2 years, it's not going to get better in 2 weeks for the most part. It takes some time for soft tissue to heal, the bones to stay in place, for the muscles to get strong again. So it's a healing process. And, getting out of pain is one thing. But I also think when I'm getting a little bit ahead of myself, when you go see a chiropractor, it's implicit that you tell them what you want. It's not what the chiropractor wants, it's what you want. So I try to get that across to patients as soon as I meet them, because it's really what I want is, I'm going to make it my best recommendation, regardless, as if you were a friend or a family member. But the idea is that what you want? Some people listen, I have pain, I just want to get out of pain. Well, any decent chiropractor is going to respect that. And since that's your wish, give people what they want. You go to a restaurant, you want your steak burned to a crisp, that's the way you like it. Well, have at it. That's what you should have. Nothing wrong with that. It's consumer driven, like just about anything else. Um, but again, be willing to listen to recommendations, because then you'll be more informed, based on good, solid recommendations. I do want to then point out the negatives for an older chiropractor. Um, and some of the older chiropractors, more experienced than me, are wonderful chiropractors. But I do have to think that at a certain point, people become bored. There's a time frame. I have colleagues who I feel should have retired long ago, and they just don't have the same zeal. They're not as enthusiastic as they once were. They're kind of a little more on the negative side. The insurance companies are doing this to them, that, and I think you'll pick up on that vibe. I mean, you kind of want a high energy office. If you're not feeling well, your energy is low. Well, what do you do to pick that up? You go to you surround yourself with higher energy people, and I think that's a good thing to do. Is because when you pick up that phone, if you get somebody like, could you please put you on hold, or you get somebody, hi, how you doing? How can we help you? Or somebody more upbeat, I would gravitate towards that. The other thing too is, I mean, I don't think you should be afraid to ask for free consultation, because the doctor doesn't know if he can help you, and you don't know if he can help you. And then consultation, 10 minutes of time to make sure you're in the right place can go a long way. So I hope you're taking these to heart, because chiropractic has its role. We're not heart surgeons, we're not medical doctors, we're not diabetes doctors. We are more like mechanics for the spine. And the spine, these days we sit down for hours and hours. Um, that's not going to go away. But you really got to think about is that, you need to maintain it like a car. The body, the skeletal system is not static, meaning that it's moving. It's constantly moving. As you get older, it's not moving as well as it did when it's brand new. Just like a car is not moving as well or performing as well as it did when you first got it. It's just the nature of the beast. So but chiropractic does have its role, and its benefit things is just back pain, neck pain, or whiplash. I mean, chiropractors do a really bang up job on headaches as well. Um, that's a whole other topic I'm not going to go into. But the one thing I tell you is, it's where I see chiropractic being effective is when you have a physical stress, an emotional stress, a chemical stress, mental, any type of stress at all. You're going to overload the sympathetic nervous system. Your sympathetic nervous system is the yin to yang with the parasympathetic nervous system that operates in the background all the time. And the sympathetic nervous system is that fight or flight mechanism that we all have. If you see a baseball coming at you, or you see a car coming at you, you respond quickly, or you sense danger and you respond quickly. So the sympathetic nervous system is really like I said, the fight or flight mechanism. So what happens is when you have a physical stress, okay, you're sitting at your desk right now. We're going through the coronavirus, and we're going to be going through it for a while longer. There's nothing we can do about it. So what happens here is you really have a stress, a physical stress. You're sitting down if you work from home. You're sitting down at your desk all day long, okay? And now you're staring at a screen, and you feel a tightness in your neck, and it hurts to move your neck, or you're just tight and achy all over. These things happen. It's a stress response from sitting down way too much. Nothing we could do about it. But if you get it, the chiropractic adjustment takes that physical stress off. It releases that tension in the body, so you have less sympathetic response. And when you have less sympathetic response time, the body starts to heal better. It heals a lot better in the parasympathetic mode. And I got to tell you something too. Here's a plug. I think acupuncture is a wonderful modality, and I have acupuncture treatments myself. And what I really feel the benefit from acupuncture as well is it really sets the body. It uses the different energy meridians to get the body into a parasympathetic, dominance. And I think it's wonderful. But I mean, I think the same thing is accomplished by removing, in the chiropractic terms, we call the bones out of place, subluxations. The subluxation irritates the nervous system, but also blocks the energy that goes from the head, goes from your brain all the way to wherever that the bone is being blocked. So you have that interference. The body has to work harder. It's kind of like a circuit breaker. You go home and you blow a circuit. You go to the box, flip it back on, and next thing you know, you have you're all good and happy to go. So what in that case, that's what a chiropractor is, a mechanic for the spine. And if you can look at it as such, you're going to see a lot the simplicity of it. But also too is when you have a mechanical issue, a medication is just a short-term fix, where chiropractic is not the short-term fix, and often it's going to take a little bit longer, and it could be somewhat expensive as well. It's not as expensive as long-term medication use and drug and surgery, but it can be expensive because you have to invest in your body. But it's important to invest in your body. You need it the longer you want to live and the healthier you want to be. I mean, I see people hobbling through Walmart all the time, and they've got these wicked walks that just would scare the heck out of you, and their pelvises are out of balance. And these people are going to have hip replacements, sure as I'm sitting here talking to you. So I guess I digressed a little bit here. To see a chiropractor makes sense when you have physical pain, okay? Especially right now, we have a special dispensation from exemption from the state of Connecticut to stay open because we are vital in a sense to keep people out of pain. They don't want you going to your primary care doctor for pain. Most people are going to go, hey, I got a doc, I have a backache. Your primary care doctor says, hey, take these muscle relaxers. And the muscle relaxers will get you out for the short term. But you ever wonder why it keeps coming back? If the problem keeps coming back, it's a little bit more serious. But hey, you take another pill, it goes away. You're not really solving the problem. So the role the chiropractors play is not only one of reducing the stress, the physical stress. It's the chemical stress that comes from having sympathetic nervous system kick in and dominate over the parasympathetic. And I'm hoping I'm not beating that one to death, but again, I was trying to say how to choose a chiropractor. Pick a guy with high energy or a gal. There's a lot of great women chiropractors. Also, just so you're aware, I mean, I have lost patients because I am a guy and I'm not a small guy. I walk in the room and they feel more comfortable with a woman. Well, you know what? That is your prerogative. You have a right to choose whoever you feel the most comfortable with. And if you came into my office, I will tell most patients this, and hopefully all patients this, you got to be comfortable with me. If you're not, I'm more than happy to send you to somebody else. It's about you getting the care you need and not about pleasing me. It's definitely not about pleasing me. It's about me listening to that patient and making sure they get what they want, not what I want. And so if you go into a chiropractor's office, and I encourage you to go in, I ask for a free consultation. Hey, can I just get a 10-minute consultation with the doctor? Why not? I mean, that may set a certain vibe. If they're agreeable, they're not agreeable, maybe they're not the right people for you. But I would encourage you to do so. You find someone, see how they listen. But also, too, is take a look around. Is the office clean? Are the magazines relatively new? Is the staff friendly? In this day and age with Corona, is everything being wiped down 2 or 3, 4 times before you even walk in the room? I hope so. And that tells that the person giving the care cares about you before you even meet them. So, you walk into an office, make sure, you see dirt on the floor. Hey, listen, maybe a kid just came in and had a whole bunch of Cheerios. Believe me, it happens. And I love seeing kids. And I don't mind. Just listen, they leave you clean up after the shift. You get the vacuum out, you tidy up. But it shows how they care about you is how the practice looks. If the place hasn't been painted in 20 years, well, maybe that's not the right place for you. It's not, and maybe that's not the chiropractor nearest you. I would encourage you to seriously seek out chiropractic care, see how you feel, see how you're treated, and ask the questions before you start care. And I think this advice would serve you very well. And if you have any questions, it's not really where the doctor goes to school. I mean, I'm biased because I went to the first chiropractic college that started in the country back in the 1800s. But that's me. I don't expect everybody to go to Iowa. I've met incredible chiropractors from all different schools around the country. There's about 20 different schools in the United States. And it's really dependent on the person who's interested, who likes what they do, and also who loves to serve patients. I mean, the biggest thrill I get is when someone comes in here in pain and we're able to help them. It really is the biggest thrill. And, it sustained me for 30 years. And I don't want to say it's sustaining me now, because right now we're seeing a couple pain patients who can't go to their primary care doctor. And I think we're doing a bang-up job of taking care of them during this COVID-19 stuff going on. Listen, I'm Dr. Brian McKay, and I think chiropractic has its place in the healthcare system. It wouldn't be around for over 125 years, or 125 years, I'm sorry, if it wasn't something that served a purpose. If chiropractic doesn't work for you, then I would say try another before you hang up on the profession totally, and see what's good for you. Chiropractic is a wonderful way to deal with stress. I tell you one thing, you will sleep a lot better after you get some chiropractic adjustments. We call the treatment an adjustment. You'll sleep like a baby. If you're not, the nervous system needs to heal. And when you take the tension, that physical stress off the nervous system, you'd be surprised at what it can do, and pleasantly surprised. So give chiropractic a care. I don't think you could be disappointed. But have that consultation first and get a feel. And if it doesn't feel right, don't worry. Just get up and walk out of the guy's office or the gal's office. That's your prerogative. You need to feel comfortable. It's your body, and we're here to serve you and guide you, but it is your body and you're right. I'm Dr. Brian McKay for Core Health in Darien. You got a question, give me a call, 203-656-3636, 203-656-3636. I'd like you to stay healthy in this trying time of COVID-19. This too shall pass. All right. Thanks a lot. Have a great day.